Welcome to the We Talk Health Podcast, the official podcast for West Tennessee Healthcare. Please be advised that this podcast is not intended to replace any medical advice. Always follow your medical professional's advice and direction. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions, please reach out to us at wetalkhealthpodcast@gmail.com, and we will do our best to answer any questions you may have.
Thank you for joining us for another edition of We Talk Health. Today we have Dr. Kimberly Burch. Dr. Burch is a pediatrician at West Tennessee Medical Group Hillview South in South Fulton, Tennessee. And today we are going to discuss some not so pleasant topics about children, but it is something that happens to all children. And so we wanted to discuss vomiting and diarrhea in infants and children. So Dr. Burch, when can that turn into a problem?
That can become a problem when the infant or the child is no longer able to stay hydrated. Especially with infants, they become dehydrated very quickly. They cannot concentrate their urine until they're several months of age, and so they will continue to urinate even if they're not taking in fluids. So if your baby has not been able to keep down the last 2 feeds, that's the time when you need to call someone, or you need to be, if you know what to do, go to Plan B. And this is Plan B. If you're going to take care of this at home, you can get Pedialyte or some other infant oral hydration solution. It doesn't have to be the name brand. They all work the same. And the goal, if the baby is no longer vomiting or having diarrhea, is to put 1 ounce per hour into the baby by mouth. You can use a dropper, that way you can measure. The best way to do it is 5 milliliters every 10 minutes, a teaspoon every 10 minutes. And what that does is it gets you to that 1 ounce goal. And that's the same for an older child as well. You can use clear fluids in an older child, such as Gatorade. You don't want to use anything that's hard to digest. You could do soup broth, something that they like. But you just don't want to use anything like milk. You want clear fluids that you can see through. Of course, you wouldn't use soda or anything with caffeine in it that would cause them to pee too much.
Not Kool-Aid.
Not Kool-Aid, probably. And then the goal there, again, is 1 ounce per hour. That would keep them hydrated. If they have other losses would be if they have still the vomiting, if they have diarrhea, if they have fever. Because with the fever, they're going to breathe faster, and in their breath, they lose a great deal of moisture. So any fever would cause them to have an increased loss. If you have an increased loss, you're going to add 1/2 ounce for every loss. So if they have a fever with the vomiting, you're going to give 1.5 ounces. If they have diarrhea and fever with the vomiting, you're going to give 2 ounces every hour. So you can see how that can add up.
Very good. Dr. Burch, can you remind us what is considered to be a fever?
Yes, ma'am. In any person, it's 100.4 or greater. So if you have a temperature of 100.4 or greater, you do have a fever. And now about the diarrhea. Sometimes the vomiting and diarrhea occur separately. Sometimes they occur together. So the most important thing to take care of is the vomiting if it is present with the diarrhea. You have to be able to keep fluids down first before you can even consider trying to take care of the diarrhea. Once you're sure you can keep them hydrated and fluids staying down, then you can do other things to help with diarrhea. So now what I'm going to talk about is if the diarrhea is by itself or if the diarrhea is with vomiting, you would treat them like this. You can give the brat diet in an older child. That's bananas, rice, or rice cereal, applesauce, and toast or dry crackers, the little puffs for an older baby. Those sorts of things really help firm up the poop so that they don't have as much diarrhea. You also want to make sure you're not giving things by mouth that are high in sugar. If you have sugary drinks, they simply cannot absorb it. They can't keep it inside. It's going to come out. It's not going to be digested properly. So in a patient who has diarrhea alone, say, you would not give milk. There's milk sugar. They can't process it. It's going to cause them to have more diarrhea. You shouldn't give them sugary drinks. If you give Pedialyte, then it's okay to give for 24 hours. If you're giving it much beyond that, it can also cause the same problem. Fluids in, fluids out.
Okay.
Other thing is if they really demand juice, some toddlers, you just can't convince them to drink anything other than what they're used to. But white grape juice is the one that has the perfect sugar. It's so easy to digest, and that would be the thing you could mix with water or something and get them to stay hydrated with that. In an older child who's 3 years of age and older, you can actually add Imodium. You can give half of one of those little green caplets of Imodium. The generic name is loperamide, L-O-P, loperamide. You can give 1/2 of those up to 3 times a day, and it really helps slow things down. But what I try to tell people is try not to do the medications unless it's really necessary. If you're having diarrhea 6 or 7, 8 times a day, you probably do need to give at least a dose of that, and then try your brat diet. And the part of the brat diet that seems to help the most is bananas. Okay. Bananas are like Imodium in infants and young children.
Okay, that's wonderful. So now that we know how to treat vomiting and diarrhea at home, when should we seek medical care?
If you have an infant who has less than 3 diapers a day, wet diapers a day, then you're going to be considering that the baby is dehydrated. You should call your doctor, at least your healthcare provider, and they'll ask you some questions. They'll ask about the baby's heart rate and make sure that it's not 120 or greater. In an older child, same thing. You want to make sure they're urinating at least 3 times a day. In both of those age groups, they need to be at least arousable. Any infant, any child who's not arousable, who is just lethargic, you want to probably go ahead and seek care. Try to make an appointment for that very morning, that very afternoon. Don't wait, because as a child or an infant gets more and more dehydrated, if they did require IV fluids, it would be increasingly hard to get an IV in. So if you do worry, and trust your mommy instincts, your parent instincts, your grandparent instincts, if you're worried about your baby, you go on and you call the office. Nobody's going to turn you away.
Great. That is wonderful advice. So we appreciate Dr. Kimberly Burch being with us today. If you are in need of a pediatrician or looking for a pediatrician for your children, you can find Dr. Kimberly Burch at West Tennessee Medical Group Hillview South Clinic on Broadway Street in South Fulton, Tennessee. Their phone number is 731-479-2606. Thank you, Dr. Burch, for being with us today on another episode of We Talk Health podcast for West Tennessee Healthcare.